Well, from a glorious 50 degrees Celsius, with that incredible volcanic ash on my back, to minus 110 degrees Celsius, really? I'm standing here at the Ice Lab with none other than Hans-Peter Meyer, and it's such a pleasure to see you and spend some time with you here.
The same for me. Very welcome, Dr. Wylde.
Yeah, thank you. So I want to learn all about this before I jump into literally minus 110 degrees. I mean, what is this doing for people?
First, I will give you a little bit of an overview. This is the first cold sauna, minus 110 degrees Celsius in North America at Sparkling Hill Resort. Minus 110 means minus 166 degrees Fahrenheit below.
So what intrigues me the most, how all of these little provisions and offerings you have are extremely therapeutic. There's science to back this. This is where I get excited. So what's this doing for people in pain, things like arthritis, or even, what I have right now, which is runner's knee? What is exactly behind the science of minus 110 degrees?
It's easy explained. All this research was done back in Germany, in Europe, and all high-end hospitals in Germany, they have their own cold sauna. The big theme is rheumatism, inflammation in your body, joint pains. If somebody suffers, for example, extreme arthritis, and if this person is using the cold sauna, hopefully at least 20 times, you can do it twice a day, means over 10 days. Afterwards, I would say guaranteed no pain for 6 to 9 months, very often longer.
6 to 9 months. We're talking rheumatoid arthritis,
yes,
or degenerative diseases of the joint tissue. You come and you spend a few minutes in a minus 110 degrees environment.
Exactly.
For 20 sessions, and you could actually experience many months thereafter of no pain?
This is true. I have experience over more than 10 years back in Europe, and I could tell stories over the next couple hours.
Wow. So firing up the immune system, as I understand it, essentially getting those cells, those anti-inflammatory cells, to the periphery where there's really little blood flow, an avascular scenario in the joint tissue. And also, as I'm about to experience, I'm very excited for this part, really boosting up your adrenalin and your norepinephrine, your feel-good hormones in the brain. I mean, this is all behind this science, right?
Exactly. Simply explained, there are more or less three big parts of how coldness works with your body. You mentioned adrenaline, endorphin rush, and you will feel it after 3 minutes already, the first session. You feel so good. You will walk out, you have a feeling you can take a tree and replant him. We know adrenaline and endorphins are natural painkillers. What is the coldness doing also? It's really a shock to your immune system and activating self-healing components in your body. Your immune system will be changed immediately with your first session. Afterwards, no pain for 2 to 4 hours immediately.
From one session?
One session. This is the short-term effect. If you do it twice a day, means 4 to 8 hours, no pain suddenly. If you are a golfer or a sportive person, you could go for your next golf run, the next 18 holes. This 4 to 8 hours no pain a day helps to make your pain memory more robust. We know all that.
Makes sense, yeah.
If somebody who suffers always under pain, they are so high sensible. If you touch them, it's already an ouch. There's no reason to have pain. And suddenly they don't have pain. Makes the pain memory more robust, getting back to normal.
Hans-Peter Meyer, the genius behind this cryotherapy here at Sparkling Hill, I'll tell you where I don't necessarily feel too bad at all. I feel pretty good. I'm so happy to hear what you're doing for those that are in pain, but I've got a little niggle in my knee here, and the old saying goes where you don't necessarily have to feel bad to feel better. I'm certainly looking forward to feeling a lot better after this minus 110 degree treatment. And I also understand that certain soccer clubs, European soccer leagues like Manchester United, even have these within their facilities. They're using this at A-level professional soccer for rehabilitation.
You are so right. For the home team, the players, they go in before they start the game. I guess adrenaline endorphin rush makes them perhaps a little bit faster the first 10-15 minutes, and also afterwards. As we know, in North America, our ice hockey players, they use this ice water after a game, and no anymore this painful ice water. You walk into a cold sauna, this dry coldness is much more easy to do and much more comfortable to do.
Amazing. And this really is the first of its kind in North America, because the rest aren't really full body. Your head's either sticking out of a contraption, or you're maybe using something that's humidified. But this is actually dry, minus 100 degree therapy.
Dr. Wylde, Zimmer, they were the first and at this point the onlyest who did this 10-15 year long study on patients. So it's clinically proven that it works. Another item, back in Europe, in France, close to Paris, the number A rehabilitation center for these high-end sportive guys like yours, they should use it even they had a surgery. What they figured out, rehabilitation time with a cold sauna might reduce rehabilitation time to half or 2/3. And we know it's a lot of money having a player back in halftime instead of waiting for many, many months.
Absolutely. Excellent stuff. Well, you don't just waltz into minus 110 degrees. There are some medical screenings that take place here. Safety first, folks, always. And I'm standing with, well, not really standing, I'm sitting here before I stand with Kevin. Kevin, what is it that we need to make sure before I walk in terms of a health level?
Well, health level, we need to check to make sure your heart is healthy. And the main way we do it here at Spa is we need to actually check your blood pressure. So to start, we're going to need full access to the left arm.
Okay.
And then we can let our machine do the work for us.
Okay. So blood pressure has to be good, normal.
With below, yes, below hypertension 1.
Okay.
And that's the basic medical requirements for the treatment.
All right.
So we'll get you just to relax the arm, take a seat back, take a deep breath in for me, and down.
World Health Organization says 115 over 75 now, down from 120 over 80 as optimal. Let's see what I have. Hopefully it's low.
Well, let's see. The score today, not too shabby at all, but definitely within our limits here.
Good.
And then we'll just take this off here, get you some safety equipment, just to make the experience a little bit easier for you.
Okay.
And then we'll be on our way.
That's a quick and safe medical. I'm on my way into minus 110 degrees, folks. Not as cold as space, but certainly damn well close.
To the nose, and then loop that around the ears. Secondary is our Larry Bird retro headband. We'll put that to the
ears.
Then we have the insulated gloves.
All right, wish me luck.
So here we go to a balmy minus 14.
Stage 1.
Stage 1 into
Boy.
minus 52.
Oh, only seconds in there, eh?
One second.
You feel like your breath is freezing instantly, eh?
It is, and while we're inside, we'll also just walk in a circle.
Okay.
And what this does, this keeps the muscle blood pumps active throughout the body.
Okay.
We'll also just wiggle the fingers and wiggle the toes.
Yep.
This is to take care of our distal appendages, because they are the furthest from the heart, and the AY, they have the protective gear on them.
Right. Sense.
And there you go.
Woo!
Congratulations.
That was an experience of a lifetime. Brings new meaning to glass cutters, but let me tell you, I didn't feel tired. I didn't feel lethargic. I felt in full rejuvenation. Wow, what an experience, let me tell you. From the literature, I expected hypothermia, feeling sleepy and lethargic. I instantly felt rejuvenated, alert. I was walking around with Kevin. Why do I feel this level of excitement, this euphoria almost? What's going on with me?
First, very easy. Oxygen inside is at least twice, sometimes 3 times higher comparing to the outside. So you're full of oxygen now.
Interesting, yes.
And of course, again, endorphins, a nice rush, and you look wonderful.
Okay, I feel wonderful, let me tell you. And explain this to me, because this is a number I've been toying around in my head. Why 110? Why minus 110? Why not minus 95? I mean, why that cold?
Very easy explained. When they did the research, they figured out the temperature has to be minus 100. This 10 degrees colder than minus 100, this is our buffer, what we will work with. Because we experienced, when you are in with a therapist,
I bring a little heat with me.
Yes, exactly. You warm the room up for about 3-4 degrees, and so we can go in with the next group, and we don't have to wait that we are in temperature again. You are right. Your body will not feel a difference between minus 95, let's say, or minus 110. It's the same feeling. But if it's only minus 95, It was only a cold experience, nothing else.
No therapeutic advantage.
Exactly, yes.
What's it about timing? I mean, do we have to be in there for the 3 minutes that I was enduring? I mean, and after a while, frankly, I could have stayed longer, but why 3 minutes?
Dr. Wylde, thank you for this question. You have to stay at least 2 minutes. All these benefits are kicking in only between 2 and 3 minutes. You could stay longer,
Okay.
4 minutes, but why you should stay there longer if everything is done with 3 minutes?
This is true, and I'll tell you, it was just a feeling of almost indescribable. Like the whole body went into elation, and of course, as Kevin was, keeping me entertained with some discussion, after about the 2-minute mark, I didn't need it any longer. I was feeling very comfortable, and I'm all excited. Talking a mile a minute here, just incredible science, an incredible experience, folks. Minus 110 degrees, I survived it, and the other thing about the neurochemistry, serotonin, this boost that I'm receiving right now, as you alluded to. I mean, I understand this is helping people with depression.
Yes, this is true. Back in Europe, we had a lot of our guests with depression issues, and the only goal, bring them in the morning to the cold sauna minus 110, and they are able to organize their days and no issues anymore.
I get it. Blood flow to the brain, more oxygen, it just makes perfect sense. Science is there to validate it as well, and Hans-Peter, I'm actually running 250 kilometers in Costa Rica soon. I mentioned to you my knee is a little bit messed up, and I hope to get that feeling better. In fact, it already feels a little bit better after the one treatment. That's crazy for me. I mean, really, it's feeling that much better. I'm running 250 kilometers for people that experience depression and other psychological disorders. So this is new news to me. It's wonderful news. And I'm just so pleased to have met you and to learn about this ice lab here that you have at Sparkling Hill. Thank you so much.
Thank you so much, Dr. Wylde. Thanks.